Friday, Groundhog Day, it seems like, right? Appreciate you all showing up again to get an update on what's been an extremely eventful week. I would say we've probably had more happen this week in the city of Sioux Falls, not only with case volume, but in responses and proposed ordinances and the city's response to this than we have to date. And I think that will be, honestly, the new normal for the next several weeks, as each week will be more intense as we continue to deal with COVID in the city of Sioux Falls. Wednesday night, as you know, we had a city council meeting, and I talked to my council about a stay-at-home order that we had a first reading on. And I set that up with a little bit of a diatribe at the beginning, talking about how 5 or 6 days in COVID days is like 5 or 6 years. Information changes rapidly, data changes rapidly, and also for us as people trying to govern this situation, we're still trying to keep this process as open and transparent as possible by sticking within the rules and the laws of city government. So, for instance, we have to notice things, and we have to give 5 or 6 days between first and second readings to allow for laws to have a first and second reading. Well, we'll be having an informational meeting at 2 o'clock today at Carnegie Town Hall. I shouldn't call it an informational meeting. It's actually a special city council meeting. I'll be chairing it for the first bit, and then I'll have to leave to head to another meeting. But the information shared at that meeting is going to be extremely important. It's going to be the most data and information that anybody will have seen to date. There's going to be a lot of information to absorb for the public. We're not hiding anything, and we're going to share it all for you. And we're going to share you the modeling and the details and the data behind that modeling and why we're making some of the decisions we're making as a city. So it will give you all in the public a chance to really see firsthand what we're seeing in our EOC, what we're looking at, and the projections we're using. I'll tell you, even since Wednesday night to today, the data and the modeling has changed, and that will continue to be a theme. So I would encourage everyone to please log on and consider watching that. You can watch it at siouxfalls.org/live, and I'm actually working just to make sure that we have the bandwidth and the capacity, because I know there's going to be a lot of eyeballs on that today at 2 o'clock. We know that there's been a number of questions surrounding the proposed stay-at-home order that the city is reviewing, the city council is reviewing. They passed that to get to pass the first reading, and it will be moving to a second reading on Tuesday night. But we're having a lot of conversations with our council, a lot of conversations with the public on that. In fact, I have a meeting with some of our city councilors after this to have a conversation on that. And so please watch the 2 o'clock meeting. I know there's a lot of questions on the stay-at-home order, what that could mean, couldn't mean. I would encourage you to watch the 2 o'clock. I think a lot of questions will get answered about that. And a lot of questions on what we're actually trying to do. What are we trying to do with the stay-at-home order? We're trying to flatten the curve, and this will answer a lot of the questions surrounding that. If you still have questions after watching that meeting, we will have sources, we will have information available. We've set up a dedicated email address, and we have dedicated employees that are going to be taking phone calls as well. So that's all I'm going to talk about today. I really just want to encourage you to join us at 2 o'clock. It's going to be a critical meeting, a lot of good information shared, so please consider logging in if you can. If you can't, I would always encourage you to follow the always good Joe Sneevy on Twitter. He live tweets our meetings, and I'm sure he will share a lot of the content that's being shared there. So I'm going to turn it over to Jill Franken, our Public Health Director, for some updates.
Thank you, Mayor. Good morning, everybody. As we've been sharing with you, we are looking at a tremendous amount of data right now. We have been, and we continue to. One of the data points we're actually following includes cell phone tracking data that's readily available in the public. This tracking data, again, it's public information, public data, allows us to look at our local population movements based on county-level cell phone movement. So this data is pretty interesting. It's showing us that for the first several weeks of our social distancing efforts, people decreased their travel by approximately 25%. And that's what we anticipate these social distancing efforts are going to gain us, is about a 25% decrease in social distancing. This is, fantastic effort, and this is what it's taking to flatten our curve. But over the last few weeks, we're seeing that people have increased their movements, their traveling. This tells us people are moving and traveling more than they have been in the previous weeks. So that means that folks are maybe starting to not do as much of the social distancing as we would like them to be. So please continue to abide by the no lingering ordinance that as well as the mayoral executive proclamation, along with the governor's executive orders. Limiting these movements continue to make an impact on slowing that spread of COVID-19 in our community. So to further help in these efforts, the health department teams have actually been in contact with a number of businesses. I think it's over 40 businesses in our community to provide some proactive technical assistance to them and information to help their businesses better make sure that they're managing social distancing effectively. Things like, conducting employee screenings, increasing efforts for environmental cleaning of those high-touch surfaces, et cetera. Inspectors are actually finding that businesses are welcoming this assistance and are being proactive in their efforts to comply with the CDC recommendations and city ordinances, the no lingering ordinance that was originally put in place. And I think we've had one, and then we had a extension of that ordinance, and that's the one that's going to be going toward to second reading on Tuesday to extend it even further. So there's a lot of things that just gives you another example of something that we are doing to be proactive for our community. We need you all now to continue to be proactive. This can be a really nice weekend. We haven't had very nice weekends lately, and that has really actually helped our social distancing in this community. This weekend is going to be so tempting for you to all go out and be out there in the community, but we need you. You have to be abiding by all of our social distancing efforts that we have put into place, the things that we've said you must do. You have to be doing that right now. It is critically important. So I'm asking you to please continue that for your own health and safety, and for us to be able to do what we need to get us through what's going to happen in the weeks to come. So with that, I'm going to turn it over to Lisa Simino. She's with the Sioux Falls VA healthcare system. They have some things they'd like to update you on.
So I want to thank you for allowing the VA to participate today. To give you a quick update, the VA started screening employees and visitors very early. So anyone coming to the VA is going to be screened with the CDC screening questions as well as getting their temperature taken. We transitioned most of our appointments to from outpatient to telehealth and telephone very early in this process. There are some visits that the veterans still need to come in person. We do ask that they call the medical center before they come in. Our number is 605-336-3230, extension 5001. And this is just so that we can make sure that they're not showing any symptoms before they arrive. And if they are, we'll give them instructions on how to proceed. We do have a nursing home in our facility, and we took very early steps to ensure that that vulnerable population is kept safe. So they've been quarantined for almost 4 weeks now, and we have staff that is making sure that they're engaged and have entertainment, but they are not allowed to have any visitors, and neither are our inpatients. But we are able to do virtual visits. So if a family member has an inpatient in the healthcare system, if you call the same number, we'll be able to connect you with a virtual visit with your loved one. Mental health is also reaching out to our veterans to make sure that they're dealing okay with the isolation. Some of the challenges that our veterans have faced, isolation can be very difficult. So if they feel the need that they need help, they're welcome to call the Veterans Crisis Hotline or call our facility and we'll connect you with your mental health provider. The VA has what's called the fourth mission, and this allows us to partake in national emergencies. So we work with FEMA in our local communities. Should the local facilities start to become overwhelmed, we will be able to back them up and take Sioux Falls citizens within our facility. So we're preparing our surge plan for both veterans and to serve as a backup to the community. Right now, we're anticipating that we'll have at least 100 beds available to serve this mission. For the most recent information to follow us, you can follow us at siouxfalls.va.gov, or our social media is at VA Sioux Falls, and we're updating that daily, sometimes hourly. So thank you. I'm going to turn it back over to Jill.
Thank you very much, Lisa. Before we open to questions, I just want to remind you all that an email address has been set up that allow people to submit their questions on this ordinance. I think the mayor referenced that. That email address is COVID-19 questions@siouxfalls.org. I'll repeat that. It's COVID-19 questions@siouxfalls.org. So please submit your questions to this address and we'll try and get them answered. All right, any questions this morning?
With the 40 businesses that are receiving technical assistance, are these businesses, how were they kind of chosen for that? Or are these businesses that have positive cases currently?
The question is, of the businesses that we've proactively reached out to and are starting to offer technical assistance to, what was the criteria by which we selected them? We selected them based on, we kind of put them in a category of those high impact versus medium versus low, and started out with the high. And, I got to really give a lot of credit out to our inspection team. Everybody, whether you're very involved in the EOC or not, and you're just part of our team outside of, being part of Incident Command or the EOC, they are constantly looking at ways that we can be, helping to aid in this work and this effort. And so Luann Ford and our environmental inspection team started proactively going out or identifying those businesses that maybe could utilize some technical assistance. Jeff Eckhoff then worked with them as well. And so it wasn't because of cases in those businesses necessarily, but it was because, they may be our larger businesses that are part of our critical infrastructure and essential businesses, that we needed to make sure that, if they are, do have a lot of employees that are working in quarters that are, a little bit more per square foot, for example, that we were able to come in and say, what kind of assistance can we provide you to further mitigate the spread in your organization?
Question about the cell phone data. Obviously, you said it has gone up. Could that be because the first 3 weeks of the stay-at-home and social distancing, the weather wasn't great, and then the data that you're receiving now reflects on when the weather was great and people were walking and talking on their phone?
Well, certainly there's all kinds of possible reasons for that, but we are it's just an example of where we're looking at all kinds of data that we have to work with. And the question was, could the cell phone data increases be related to nicer weather? And again, that's certainly possible. Nothing is, outside the realm of possibility with that, but it does underscore that if people are out and interacting, they need to be socially distant from others. And so it gives us pause when we see that, and creates a question for us is, are we actually mitigating the spread through our social distancing efforts? And if not, what do we need to be doing about that? And so that's just another data element that we're working off of.
So this weekend, people going out, what's the advice? I mean, should you wear a mask outside?
Well, there's guidance out there that suggests that you should. You see me wearing mine right now. It's very difficult for me to effectively communicate with all of you if I have my mask on. But, that's what we have guidance out there that suggests that if you can wear a mask, and if you're going to be out in public, that it is a good idea to, consider wearing one to prevent that spreading to others. There's less evidence that can, say that you're going to be well protected necessarily, but it's how you can then prevent from and protect others by you wearing a mask. And so those are things that we need to continue to, lift up as ways that we can. That's why we have masks required to be worn throughout the halls of the law enforcement center. It's why we're requiring masks in the health department. It's why you're now seeing more of this just commonplace all over our community.